Hello, everyone, and welcome to the Well Woman podcast with me, Dr. Frances Pitzilis. Today, I'd like to talk to you about a very serious topic which involves helping our aging populations to age well. And this is because we have a tsunami in many Western countries, including New Zealand, of a big amount of older people coming our way, if not already. And along with that, we have a reduced fertility rate, which means there are going to be fewer young people to support them. Now, I'm a doctor who practices integrative or functional or precision medicine, according to which country you might be in. I see patients that don't do well with their chronic and difficult health problems, and I'm mostly able to help. This is a result of the research and training I've done over the last 26 years. The results I see include improvement in quality of life factors like sleep, energy, mood, anxiety, memory, and general function, along with relief of pain. And I see adults, and adults of all ages. In fact, quite a few years ago, I recorded a television series here in New Zealand called Is Modern Medicine Killing You? And it won the ratings. And this is where I helped my patients recover when they had not been able to after seeing other doctors. Now, more and more, my patients are asking for help in maintaining their well-being as they age. And here are some case examples. A 75-year-old woman had not seen me for 2 years and her program had lapsed. Her husband brought her in and I observed that she had become frail. She was unable to walk unaided and she had to hold on to everything as she walked into my consulting room. I corrected her biochemical and hormone deficiencies, and 2 months later she walked in normally and informed me that she had driven over the Auckland Harbour Bridge. Here's another example. A man who has both genes for Alzheimer's disease has a 70% risk of developing the condition. He started my program aged 59. He's now 80, working and rides a motorbike. His brother has been under care for 7 years. The national New Zealand breast cancer rate is 1 in 9 women. I suggest that I prescribe probably more hormones than the average family doctor, and I'm aware of how to correct nutritional biochemistry and hormone imbalance safely as I do my second opinion doctor work. Over the last 25 years, I've had 4 breast cancer patients and they're all still alive, so my rate is far lower. Here's another example of a woman in her early 60s with diabetes type 2 who had returned to see me after a few years absent. She had gained a lot of weight and she told me she couldn't think properly. She had been going to the diabetes nurse at the hospital. I changed her diet, and before her next visit, she had been able to come off insulin, lost 5 kilograms, and her thinking had become normal. She still had some issues with some numb feet, which we call peripheral neuropathy. But by the 3rd visit, the feet were now better. And not only that, her vision had improved so much that she had to get weaker glasses. And this patient stopped seeing the diabetes nurse at the hospital. Here's a case of a younger woman, aged 35, who told me that she's had chronic fatigue for 20 years. I corrected all her deficiencies. That's what I mostly do, identify and correct deficiencies. One of them was an undiagnosed underactive thyroid, and at the second visit 2 months later, she was well and was now able to start working. Another case, woman aged 56 with fibromyalgia and chronic pain. I could not give her hormones because she'd had breast cancer. But by the second visit, her pain had gone from 8 out of 10 to 3 out of 10. So this just shows you that my study and research in relation to correcting the diet, correcting lifestyle, correcting nutritional, hormone, and biochemical imbalance works. So what I really want to talk to you about today is that New Zealand's health system, and probably a lot of Western systems, are facing an unsustainable burden of chronic disease, with nearly 1 in 3 adults living with at least one long-term condition. And this accounts for almost 60% of our health expenditure here in New Zealand. I believe much of this burden is preventable. However, the current system remains largely reactive and drug-centered, intervening quite late rather than addressing early any underlying nutritional, metabolic, and hormone drivers of disease and functional decline. I have submitted to our government a scalable, evidence-based national preventative strategy with some policy suggestions. And this strategy is embedded within primary care and community services and aimed at improving health span, reducing chronic disease, and enabling New Zealanders to age well. Drawing on my over 25 years experience in integrative medicine, this model focuses on the early identification and correction of modifiable risk factors, ideally beginning in the 40s or 50s before irreversible disease develops. Look at their own profile, look at their family history, and start doing some prevention. So my core proposal is to establish a nurse-led prevention and longevity clinic within general practices around the country, similar to the fact that nurse-led clinics for asthma and diabetes programs exist. So these clinics would identify early risk factors and monitor key biomarkers such as vitamin D, insulin resistance, and other things, along with the general practitioner's oversight for safe prescribing of hormones or medication where required. Accredited education for GPs and nurses would be supported through organisations such as, for example, the Australasian College of Nutritional and Environmental Medicine, ACNEM for short, and this would ensure consistent standards and evidence-based practice. What I've also suggested is that there would be government funding for essential nutrient and hormone testing that isn't done at the moment, that's not funded at the moment. And so extending the funding for things such as testing vitamin D, insulin, zinc, and copper, and DHEA. Some regions in New Zealand don't fund some tests at all for certain doctors. Now, GPs already prescribe estrogen and progesterone, but they can be supported to receive further education in a safe way to correct hormone deficiencies such as DHEA and testosterone, which are under-recognised at the moment, but yet they are vital for muscle, bones, mood, and cognition for both sexes. What I'm also calling for is subsidies for proven natural therapies like fish oil, vitamin C, curcumin, resveratrol, DHEA. These have been shown to reduce inflammation, support cognition and mental health and memory, support cardiovascular health, and potentially reduce reliance on long-term medications. Here's some brief information about a few things. Fish oil reduces cardiovascular and mental health risks, potentially lowering antidepressant use. Curcumin and resveratrol improve inflammation, blood vessel function, and help to prevent metabolic, pre-diabetic, and cognitive decline. DHEA reduces cognitive problems, dementia, heart disease, strengthens bones, reduces diabetes type 2, and helps weight loss and gives natural resilience. Vitamin D reduces risk for 17 cancers, is antiviral, protects the heart and brain and bones, and is important for over 1,000 genes. In New Zealand, it's funded on prescription. And DHEA is not well taught, but it has a substantial role in prevention. So, recognizing nutrition as foundational, my proposal recommends looking at subsidizing access to fresh fruit and vegetables for older people. And any funding models that people should consider should reward prevention and health improvement. At the moment, there's no motivation to improve function in your patients, to improve blood tests and that sort of thing. There is motivation for vaccination, but we need that to be extended to view improvements in health function and health biometrics, not just managing diseases. So at the moment, GPs receive capitation payments linked to the profile of their patient population. So that could be looked into. Data could be collected to show savings from perhaps reduced drug use, reduced hospital admissions, and a reduction of operations. Our Accident Compensation Commission can identify statistical changes in falls and accidents. So these are some ways that prevention and health improvement could be monitored. So to ensure quality and consistency, I think GPs and nurses can receive accredited training through organisations such as ACNEM, and they can be mentored by experienced integrative medicine doctors. There could even be a national preventative health advisory group with the right people on it, and they could establish to oversee curriculum standards, evidence review, and audit outcomes. And people who practice integrative medicine like I do should be recognised as an essential part of the public health strategy. So to support this further, what would happen? Well, you'd have to bring in ACNEM accredited or similar courses into postgraduate general practice education. There should be continuous professional funding for doctors and nurses to do this and learn prevention and lifestyle medicine training. There could be a national network of regional mentors to supervise these nurse-led clinics and their GPs. To help with all of this, we could obtain assistance and cooperation from the New Zealand Medical Council, and they should accept evidence-based information on some of the natural therapies that could be used. There could be appointed a guidelines research group that could solidify some of the guidelines that integrate lifestyle, diet, natural therapies, and then drugs. So here's an example. Diabetes type 2, exercise, diet, fish oil, vitamin C, correct zinc, magnesium, then later drugs. Here's another example. Dementia prevention, exercise, restore sleep, correct hormones and nutritional deficiencies, correct underactive thyroid, give proven natural therapies like fish oil, clear any toxicity from the body, drugs last. So I'd like to suggest that this type of prevention first approach would delay or prevent chronic disease, reduce drug use, keep people independent and working longer, lower hospital admissions, and deliver substantial long-term savings. It's not about creating more rest home beds. Yes, perhaps we need those, but it's also about helping people to age well and not use up the healthcare services as much and not require the rest home beds for as long. I think that with appropriate governance, education, and pilot programs, my suggested strategy offers a practical and fiscally responsible pathway to healthier aging and a more sustainable health system for New Zealand. So I'd like to summarise all of this. This prevention strategy will reduce chronic disease rates and medication dependence. It will delay or prevent chronic diseases, including heart disease, osteoarthritis, stroke, cancer, diabetes type 2, dementia, and frailty. It will save billions in long-term healthcare costs. It will allow more people to work and pay tax. And it will improve national well-being and productivity. To achieve this, New Zealand must fund nurse-led prevention clinics that are supported by GPs and start the process early. New Zealand must support GP and nurse education programs. It must support integrative medicine research and guidelines for chronic diseases and prevention in general. It needs to fund essential nutrient and hormone testing. It needs to subsidise proven natural therapies and hormone therapies. I'd like to suggest that we look at improving access to fresh produce for older adults, and even create initiatives for older people to exercise, including resistance exercise. So thank you for listening to me. I'm glad I got this out there. I would really like people to take notice of what is ahead of us and what we really should be doing from my point of view. And I think my strategy can be integrated and perhaps form part of the jigsaw of the overall strategy that the country needs to adopt because of the rising percentage of older people and the diminishing percentage of younger people that are going to have to support these older people. As always, please don't use any of this for your own health care. It's for education and entertainment. Go to your own healthcare professional. I hope you enjoyed it. Please share, like, and subscribe, and I'll see you in the next one.